Have you ever wondered why your grandfather could sleep through the night without interruption, but you find yourself making multiple trips to the bathroom? What if I told you that there's an ancient berry used for centuries by traditional healers that could help restore those peaceful nights of uninterrupted sleep? A berry so powerful that modern research is finally catching up to what our ancestors knew all along. I'm Dr. Fernando Manocchi, and after 15 years as a cardiovascular surgeon and now as a health educator, I've seen how nighttime urination affects not just sleep quality, but overall health and heart function in my patients over 50. Today, I want to share with you something that could change your nights forever. But more importantly, I'll explain the science behind why this happens and what you can do about it. Let me paint you a picture. Imagine your bladder as a balloon. When we're young, this balloon has strong, elastic walls and a perfectly functioning valve at the bottom. But as we age, several things happen. The balloon's walls become less elastic, like an old rubber band that's lost its stretch. The valve, which should stay tightly closed during the night, starts to weaken. And here's something most people don't realize. Your body's natural rhythm of hormone production changes dramatically after 50. During our younger years, our bodies produce higher levels of a hormone called antidiuretic hormone, or ADH, especially at night. Think of ADH as your body's night shift supervisor, telling your kidneys to slow down urine production while you sleep. But as we age, this night shift supervisor becomes less reliable, often showing up late or not at all. This isn't just about inconvenience. When you wake up multiple times during the night, you're disrupting your sleep cycles. Deep sleep is when your body repairs itself, when your heart rate slows down and gives your cardiovascular system a much-needed rest. Fragmented sleep could be associated with increased blood pressure, higher stress hormone levels, and even greater risk of heart problems over time. I remember treating a patient, let's call him Robert, who came to me concerned about his heart palpitations. As we talked, it became clear that Robert was waking up 4 to 5 times every night to urinate. He was exhausted, his blood pressure was climbing, and his quality of life was suffering. What Robert didn't realize was that his sleep disruption was creating a cascade of problems throughout his body. Now let me tell you about the factors that many people don't realize could be contributing to this problem. First, certain medications that are commonly prescribed to people our age can have unexpected effects on bladder function. Diuretics obviously increase urination, but many people don't realize that some blood pressure medications, particularly calcium channel blockers, may affect bladder muscle tone in some individuals. If you're taking any medications, this is absolutely something to discuss with your doctor before making any changes. But medications aren't the only culprit. Our modern lifestyle plays a significant role too. The timing of when we consume fluids, the types of beverages we choose, and even our stress levels all influence our nighttime bathroom habits. Caffeine, even from that afternoon cup of coffee, can stay in your system for 6 to 8 hours, acting as a mild diuretic. Alcohol, while it might make you sleepy initially, actually disrupts your sleep quality and can increase nighttime urination. Here's where our ancient ally comes into the story. The berry I'm talking about is the cranberry, but not in the way you might think. For centuries, Native American tribes used cranberry not just for urinary tract health, but specifically for what they called night water troubles. Modern science has now identified why this humble berry is such a powerful ally for nighttime urinary health. Cranberries contain unique compounds called proanthocyanidins, which are like tiny bodyguards for your urinary tract. These compounds help maintain the health of the bladder lining, making it less susceptible to irritation that can trigger the urgent need to urinate. But here's the fascinating part that research has revealed in recent years. Cranberries also contain natural compounds that may help support the normal muscle tone of the bladder walls. Think of your bladder muscle as a rubber band around a water balloon. When this muscle is healthy and strong, it can hold more comfortably and release more completely when appropriate. The compounds in cranberries, particularly when consumed in their whole form rather than as highly processed juice, provide nutrients that support this muscle function. But there's more to the story. Cranberries are rich in antioxidants, particularly vitamin C and anthocyanins, which give them their deep red color. These antioxidants help reduce inflammation throughout the body, including in the delicate tissues of the urinary tract. Chronic low-level inflammation is something we now understand plays a role in many age-related changes, including changes in bladder function. Recent studies have also shown that cranberries may help support the body's natural circadian rhythms. Remember that night shift supervisor hormone I mentioned earlier? The antioxidants in cranberries may help support the body's natural production of melatonin, which works closely with ADH to regulate our sleep-wake cycles and nighttime urine production. Now let me be very clear about something important. While cranberries can be a valuable ally in supporting urinary health, they're not a magic solution that works overnight, and they're certainly not a replacement for proper medical evaluation. If you're experiencing sudden changes in urinary patterns, pain, burning, or other concerning symptoms, you need to speak with your healthcare provider first. These could be signs of conditions that require medical attention. But for many people dealing with the gradual increase in nighttime urination that comes with aging, cranberries can be part of a comprehensive approach to better sleep and urinary health. The key is understanding how to use them most effectively. Here's what's crucial to understand. Not all cranberry products are created equal. Many commercial cranberry juices are loaded with added sugars and have been processed in ways that destroy many of the beneficial compounds. The sugar content alone can actually worsen nighttime urination by causing blood sugar fluctuations that trigger more frequent urination. The most effective approach is to consume whole cranberries or cranberry products that maintain the full spectrum of beneficial compounds. Dried cranberries without added sugar, cranberry powder made from whole berries, or fresh cranberries incorporated into meals can be excellent options. Some people find that a small serving of unsweetened cranberry sauce, made with just cranberries and a touch of natural sweetener, like stevia, provides benefits without the blood sugar spikes. Timing is also important. Rather than consuming cranberries late in the evening, which could potentially increase fluid intake before bed, many people find it more effective to consume them earlier in the day. This allows the beneficial compounds to work throughout your system, while giving your body time to process any additional fluids before bedtime. Let me share another important ally that works synergistically with cranberries: pumpkin seeds. These small but mighty seeds have been used in traditional European medicine for centuries to support urinary health, particularly in men dealing with prostate-related urinary issues. Pumpkin seeds contain zinc, healthy fats, and compounds that may help support normal prostate size and function. The combination of cranberries and pumpkin seeds creates what I like to think of as a power duo for urinary health. The cranberries support the bladder lining and muscle tone, while the pumpkin seeds provide additional support for the entire urinary system. A small handful of raw, unsalted pumpkin seeds, along with a serving of unsweetened dried cranberries, can make an excellent afternoon snack. But our ancient berry and its allies work best as part of a holistic approach to better nighttime urinary health. Let me share some additional strategies that can amplify these benefits. First, let's talk about hydration timing. Many people make the mistake of either drinking too much in the evening or restricting fluids too severely during the day. The ideal approach is to consume most of your daily fluid needs in the morning and early afternoon, then taper off in the hours leading up to bedtime. Think of it like watering a plant. You want to give it plenty of water when it can best use it, not right before you want it to rest. Bladder training is another powerful tool that works beautifully alongside our nutritional allies. This involves gradually extending the time between bathroom visits during the day, which can help retrain your bladder to hold more comfortably. Start by waiting just an extra 5 minutes when you feel the urge, then gradually increase this time over several weeks. This technique, combined with the bladder-supporting nutrients from cranberries, can create significant improvements. Pelvic floor exercises, often called Kegel exercises, are equally important for both men and women. These muscles act like a hammock supporting your bladder and other pelvic organs. Strengthening them can improve your ability to control urination and reduce urgency. The beauty is that you can do these exercises anywhere, anytime, and nobody knows you're doing them. Sleep positioning can also make a difference. Elevating your legs for a short period before bed can help redistribute fluids that may have accumulated in your lower extremities during the day. This prevents a sudden rush of fluid back into your bloodstream when you lie down, which can trigger increased urine production. Now, let's talk about foods that can either help or hinder your progress. Beyond cranberries, other foods can support urinary health. Blueberries, like their cranberry cousins, contain beneficial compounds that support urinary tract health. Watermelon, despite being high in water content, actually contains compounds that may help support kidney function and healthy urine production patterns. Foods rich in magnesium, such as dark leafy greens, nuts, and seeds, can help support healthy muscle function throughout the body, including the bladder muscles. Magnesium also plays a role in stress reduction and better sleep quality, which can indirectly improve nighttime urinary patterns. On the other hand, certain foods and beverages can worsen nighttime urination. Spicy foods, artificial sweeteners, and highly processed foods can irritate the bladder lining in some people. Alcohol not only acts as a diuretic, but also disrupts the normal production of ADH, that important night shift supervisor hormone we discussed earlier. Caffeine deserves special mention because its effects can last much longer than people realize. That cup of coffee at 2 p.m. could still be affecting your system at bedtime. If you're dealing with frequent nighttime urination, consider moving your caffeine cutoff to earlier in the day, perhaps before noon. Stress management is another crucial piece of the puzzle that works synergistically with our nutritional approach. Chronic stress can affect hormone production, sleep quality, and even bladder function. When we're stressed, our bodies produce more cortisol, which can interfere with the normal production of ADH and disrupt our sleep cycles. Simple stress reduction techniques like deep breathing exercises, gentle stretching, or even a warm bath before bed can help activate your parasympathetic nervous system, your body's rest and repair mode. This creates the optimal environment for the beneficial compounds in cranberries and other foods to do their work. Regular gentle exercise also plays a supportive role. Walking, swimming, or other low-impact activities help improve circulation, reduce stress, and support overall health. Better circulation helps ensure that nutrients from foods like cranberries reach the tissues where they're needed most. Let me address something important about expectations and timeline. Unlike pharmaceutical interventions that might show effects quickly, nutritional approaches like incorporating cranberries work gradually as your body's systems rebalance. Some people notice improvements in sleep quality within a few weeks, while for others it may take a couple of months to see significant changes in nighttime urination patterns. This is why consistency is so important. Think of it like tending a garden. You need to water it regularly and give it time to grow. The same is true with nutritional support for urinary health. A handful of cranberries once a week won't create lasting change, but incorporating them regularly into your routine, along with other supportive habits, can create cumulative benefits over time. It's also worth noting that individual responses can vary significantly. Some people find that cranberries work best for them when combined with other approaches, while others see benefits from cranberries alone. This is why it's so important to work with your healthcare provider to develop an approach that's tailored to your specific situation and health status. For those dealing with medication-related urinary changes, cranberries can be particularly helpful as a supportive measure, but never as a replacement for necessary medications. If you suspect your medications might be contributing to nighttime urination, discuss this with your doctor. Sometimes simple adjustments to timing or dosage can make a significant difference, and your doctor can help determine if cranberries or other nutritional supports are appropriate additions to your regimen. Now, let me give you a practical action plan that you can start implementing right away. Remember, these are general suggestions, and you should always consult with your healthcare provider before making significant changes to your diet or routine, especially if you have existing health conditions or take medications. First, introduce cranberries gradually into your daily routine. Start with a small serving, perhaps a tablespoon of unsweetened dried cranberries or a quarter cup of fresh cranberries added to your morning oatmeal or yogurt. Pay attention to how your body responds and adjust accordingly. Second, optimize your hydration timing. Aim to consume about 60 to 70% of your daily fluid intake before 2 p.m., then gradually reduce intake in the evening. Stop drinking fluids entirely about 2 to 3 hours before bedtime, except for small sips if needed for medications. Third, create a consistent bedtime routine that includes some of the supportive practices we've discussed. This might include a few minutes of gentle stretching, some deep breathing exercises, or elevating your legs while you read or watch television. Fourth, keep a simple sleep and urination log for a week or two. Note what you eat and drink when you consume it, how many times you wake up to use the bathroom, and how you feel in the morning. This information can help you identify patterns and track improvements over time. Fifth, be patient and consistent. Remember that sustainable changes in health happen gradually. Give your new routine at least 4 to 6 weeks before evaluating its effectiveness, and don't be discouraged if you don't see immediate dramatic changes. As we wrap up our discussion, I want to remind you of something important. Your body has an incredible capacity for healing and adaptation, even as we age. The key is providing it with the right support through nutrition, lifestyle habits, and appropriate medical care when needed. That ancient berry, the humble cranberry, represents something beautiful about the wisdom of traditional medicine meeting modern science. For generations, people have turned to natural foods for healing and support. And now research is helping us understand why these approaches can be so effective. Your journey to better sleep and improved nighttime urinary health doesn't have to be complicated or expensive. Sometimes the most powerful solutions are the simplest ones. A handful of berries, some gentle exercises, better hydration habits, and the patience to let your body heal and rebalance. Remember, every small step you take toward better health is an investment in your future self. Better sleep means more energy, improved mood, better cardiovascular health, and a higher quality of life overall. You deserve to wake up refreshed and rested, not tired from multiple nighttime interruptions. If this information has been helpful to you, I encourage you to share it with someone you care about who might also benefit. Sometimes the most precious gift we can give someone is the knowledge that can improve their daily life and health. Take care of yourself, be patient with the process, and remember that your healthcare provider is your best partner in creating a plan that's right for your unique situation. Sweet dreams and restful nights are not just a memory from your youth. With the right approach, they can be part of your future too.